Good evening, and thank you for joining us for the two-part series, The Rollercoaster of Caregiving, Navigating the Ups and Downs During COVID-19, a mental health roundtable discussion for caregivers. This is part one. I am Angela Bailey, Executive Director for the Kensington Reston, an assisted living and memory care community in Reston, Virginia. At Kensington Senior Living, our promise is to love and care for your family as we do our own. We are committed to improving the quality of life for seniors as well as the caregivers who love them. So we seek out support from specialty experts to deliver topical information and resources that help boost caregiver morale, preserve energy, and keep stressors in check, especially now in our COVID-19 reality. Just a couple of housekeeping items before we start. This presentation is in webinar format, which means your camera and microphones are off. If you have any questions during the presentation, feel free to type them in the Q&A box. This evening's moderator will take the time throughout the presentation to answer a few of your questions. At this time, could our presenters join me? Thank you. Tammy, would you please introduce yourself and tell us a little bit about yourself?
Sure. Hello, everyone. Thank you for joining us today as we discuss navigating caregiving and COVID, the ups and downs. My name is Tammy Anastasia. I am a dementia consultant and educator, a health and wellness counselor, and I am also the author of the book called Essential Strategies for the Dementia Caregiver, Learning to Pace Yourself. I also facilitate 4 caregiver support groups, and I have a private practice, and I work one-on-one and provide dementia guidance, emotional support, and care strategies for people taking care of a loved one with dementia. And I hold a master's degree in counseling, a certificate in gerontology, a certificate in end of life, and I'm also a certified dementia care specialist. And I'm really looking forward to having this discussion with you today.
Thank you so much, Tammy. Next, we have Dr. Mand.
Hello, everybody. This is Dr. Rochelle Mand. I'm very happy to be here. I am a licensed marriage and family therapist and a psychologist. I have been in practice since 1980, which is a really very long time. I'm privileged and honored to be in this business, and I'm looking forward to talking with you about some of these issues. I have a general practice, but I specialize in caring for the caregivers because their stresses are tremendous amount of stress that the caregivers go through. And so I am looking forward to learning and teaching and being part of this community today.
Thank you so much, Dr. Mand. And now we have Dr. Mandati.
Hi, everyone. I'm Dr. Vikas Mandati. I'm a adult and geriatric psychiatrist. I'm experienced in treating mental health conditions and problems for older adults. I believe family and social support are extremely important to the care of elderly adults, and I hope that I can share some insights with you that may be helpful to a caregiver and their loved ones.
Thank you so much, Dr. Mandati. And now we have Dr. Edisam, our moderator for this evening.
Hi, everybody. I'm Dr. Edisam. Thanks for joining us this evening. I'm a PM&R trained physician. I do a lot of rehab with specifically more stroke, brain injury, spinal cord injury, trauma as a medical debility. I'm currently the medical director of the Reston Rehab Unit, and my patients frequently have to deal with mental health issues.
Thank you so much, Dr. Edisam. So I will let you guys get started. And again, thank you all.
All right, so I'd like to get started with just discussing mental health in general. So I guess our first question that we can lead off with is, what is mental health? I know it's kind of an all-encompassing term. It includes maybe some of our emotional, our psychological, and even social well-being. It affects a lot of who we are and how our lives proceed around us. It determines how we handle stress, how we relate to others, and a lot of the choices that we make. So with all that, I'll pass it off to Miss Tammy and let her get started on how she would describe mental health.
Yeah, it's definitely our social, our mental, emotional, psychological well-being. It affects the choices we make. It affects how we take care of ourselves. I also think it affects how we process information. And I think it also affects, how we are in the world, how we perceive ourselves to be, and how we relate to others. So I kind of see it as all inclusive. It's the whole person. And our mental health is also affected by stressors. And we could, for example, people who take care of somebody with dementia, we could be in really good mental health, but the wear and tear of the whole journey can cause caregiver stress, depression, and it can change our mental health. So it's really important. It's that fine line between caring for ourselves, maintaining our own mental health, and then caring for a loved one with dementia.
Great. Dr. Mand, anything to add?
Yes, I think in addition to what both of you have said, we are dimensional beings and we have to take care of our physical health, spiritual health, and mental health. Mental health is basically the well-being of your psychological self. If we were to define it, actually bring it down to very specifics, it's the ability to deal with and to face life's obstacles in a constructive way. That's what that is. And we could look at a lot of examples. Constructive being, you analyze the problem, you try to talk to people about it, you figure out ways to handle it, and then you implement them. Destructively would be to resort to violence, to alcohol, to denial, to depression, to a variety of other behaviors that will not solve the problem.
Good. And Dr. Mandati, anything else that you'd like to input?
Those are some great definitions. What I'd like to add is that, mental health is how we handle our emotions and thoughts. It's our ability to cope with stress, connect with others, make choices. Essentially, it's how functional we are. It's important to maintain positive mental health throughout your life so that at every stage of life, you can be the best version of yourself.
And I agree. So like I said, I'm a rehab doctor and our whole focus is function. And truthfully, my field in particular is called physical medicine rehabilitation. But I mean, it really, really is important how much mental health plays a role in that. When you're recovering from anything, a sprained ankle, a brain injury, a spinal cord injury, I mean, mental health, I would argue, is one of the most important things that anyone can really take care of. So as we go through tonight, we have a list of questions that I'll be choosing from, and we'll all be discussing these questions. But I want to encourage the participants and the listeners to feel free and send in some questions from the Q&A chat. I will also be able to call some of the questions out from the crowd, and we'll be able to address them as we go. And most of our questions tonight will be focusing on caregiving, the burden of caregiving of a loved one who has some mental health issues, and especially in this time with the pandemic raging on. I know times are tough. So one of the first questions I'd like to start with is, how do I get my loved one with dementia to comply with COVID-19 guidelines? I'll start with you, Dr. Mandati.
There's different things that you can do, in terms of like hand hygiene, for example. You can place signs in the bathroom that can remind those with dementia or memory loss to wash their hands. You can establish a habit of hand washing by demonstrating it yourself. When that isn't possible, you can use hand sanitizer. Another thing is, wearing a mask can be very difficult, especially if your loved one is non-compliant. Make sure the mask is comfortable. You could consider a face shield. Sometimes it's possible that they can't wear one. And another thing is, maintaining a 6-foot distance, which is often common in COVID. Maintaining a distance can be difficult, especially at later stages of dementia. But, you can try to schedule visits outside to limit risks, and you can provide N95 masks for the visitors as well.
Dr. Mand, any thoughts?
I have a hard time with this whole issue of social distancing and COVID regulations and so forth. I think some of it maybe arbitrary. And so, for instance, I think that if you have a group of seniors and nobody has any symptoms, nobody is diagnosed with COVID, they can hang out together. In my opinion, they can hang out together. If anyone has a symptom, obviously they can be isolated, and they can be kind of removed. But to the extent that there is no symptoms going on, people need to interact. Lack of social interactions kills your spirit. It's terrible for us, for all of us, especially for our seniors who are isolated a lot of the times. So I would say I would want to put a lot of emphasis on helping them build up their immune systems, like being out there in the sun, taking vitamin D, taking all the other, supplements and so forth, and providing some social interactions so that their minds and their spirit are fed in addition to their bodies.
That's a great point. I know isolation can also be very tough, especially in times like this. And I know it's a tough time given everybody's dealing with different, different regulations, whether it be from the state level, your local government, your institution. So navigating all that can be very difficult. And Tammy, I'll toss the same question towards you.
Yeah, I'd like to add to that. That was a major, major issue when March 2020 rolled around, right? And for the first 6 months, one of the most common calls I got from caregivers were, how do I get my loved one to abide by the guidelines? So it was so troubling that I actually came up with what I call three rhymes. So people with cognitive impairment, we have to learn to relate on their level, right? So we have to meet them where they're at. So I thought, okay, what are some ways we could meet the person with cognitive impairment and put things in a frame of reference that they might be able to relate to? So in a lot of research that I've done on how to relate to them, a lot of rhymes work very well. So I'm actually going to share the three rhymes that I came up with, and people can modify it. But I think you're going to get the gist of how these rhymes and the feedback I got about these rhymes surprisingly were very, very well received. So for wearing a mask, what we say to the person with dementia will be, if we're going outside to do a task, we must wear our masks. And what we did with that is we put up a chart on the wall. So the person with dementia came like a game, or it gave them a sense of purpose, or gave them a sense of value, and they would check off how many times they wore a mask. And it became some sort of a way of a win-win for the person who has cognitive impairment, as well as for the person who is trying to get their loved one to wear a mask. The other thing that's nice about the mask is we could personalize it. So if they're a football player or a fisherman, we can personalize these masks, and these masks become something that are super special and they want to take care of, and they have pride in it. And believe it or not, they're actually willing to put on a mask. So it's a way of relating to them at their level. Then the one for social distancing, because there's a lot of people going along with Dr. Mann, what she has to say, but there's a lot of people who don't want people intruding in that space. So then the person doesn't understand this person has cognitive impairment. So the rhyme I came up with for social distancing was, standing or sitting 6 feet apart keeps us safe and makes us smart. And these rhymes resonate with people with cognitive impairment. And again, it becomes a game. It becomes something that we, again, can relate to on their level. And then the other one is, washing our hands 10 times a day helps keep the doctors away. And here again, we would put up a chart. We might check off how many times we washed our hands. But I think when we're trying to encourage people with cognitive impairment to do things that are in their best interest, we have to find a way to deliver that information at a level that they can relate to. And so you can modify these rhymes, but here again, it's at their level, relating in a way that hopefully we can get them to comply to the best of their ability.
Those are all great suggestions. Very catchy rhymes too. I'm sure they would help. So the next question I think I'll toss out to everybody is, should you do everything for the seniors to help them, even if they can do it for themselves? We'll get started with you, Dr. Mandati.
I think it's important to maintain independence and autonomy within reason. The loss of independence can have a toll on the senior's mental health. However, if your loved one is placing themselves in dangerous situations, then you should consider a higher level of monitoring, and you might have to take away their independence, but that's because of their safety.
I agree. That's a very valid point. I know even with, like I said, from my experience too, it's nice to make sure people feel independence. I mean, it makes them truly feel valuable. It makes them feel like they're able to care for themselves, and it definitely helps build their self-confidence. So I totally agree. Dr. Mand, anything else to add?
Just to keep in mind that these older citizens have lost some amount of independence, control over their bodies, and they don't feel as dignified as before. And I think that if they're able to do some things for themselves, to the extent that they can do it, they should do it, because it helps them keep a feeling of I'm still useful, I can still do things, I can still take care of myself. But obviously, you just have to keep an eye on things to see whether they can actually do it or not. And when it comes time to help, it has to be in a very, very dignified manner, so that the person doesn't feel like they're being handled like a child.
I totally agree. That's a very valid point. Miss Tammy, anything else to add?
Yeah, I would like to expand on that. A lot of people think with people who have cognitive impairment that that sense of purpose and that sense of value, it's still super, super, super important. And no matter how much the disease progresses, we do want to encourage them to maintain as much independence as possible. But as they lose that independence, there's still ways to give them a sense of purpose by focusing on the things they can still do. And I think sometimes what happens with cognitive impairment, we get so caught up in all the things they can no longer do. And we really want to foster as much independence, sense of importance, sense of value as much as possible. So we still want to capitalize on the things they can still do. One of the things people hate the most with dementia or non-dementia is being told no. And a way to work around no is by saying, that may not be a good idea, but I know this would be super great if you could do this. And we focus again on things they can do and empower them, and again, give them that sense of purpose and that sense of value. That doesn't go away. They need that from the time that they're diagnosed all the way, I believe, till end of life. And we can still foster that independence by focusing on the things that the people with cognitive impairment can still do, of course, keeping in mind that they remain safe and there's no harm to themselves or others.
Definitely. I mean, I think redirection is a great strategy for a caregiver to use. I know it's tough. Obviously, caring for a loved one and watching them decline over years and years can also be tough on the caregiver as well. So my next question I'd like to toss out to the team is, what can I do if I'm overwhelmed from caring for my loved ones and I need a break? We'll get started with you, Dr. Mand.
Wow, that's an area that we can talk for a very long time about. As you know, I work with caregivers in my office all the time, and there's just a long list of stuff that we go through in terms of dealing with stress. Number one would be to know yourself, your body, your mental capabilities, to know when enough is enough for you, and to be able to pick up the signs of physical stress that you have. Some people get a headache, some people get a stomach ache, some people, some other physical things happen. So it's really important to know that and pay attention to it. Or psychological stress, if you feel overwhelmed. Some people get stressed out and it shows up in feelings of anger, frustration, other kinds of feelings. So number one is to be aware of how your own system works. I don't know how much time you want me to give to this, but I have a whole list of things that I go through in terms of living a balanced life, in terms of taking time to breathe and meditate, in terms of delegating your work, talking to siblings, looking at financial issues, all kinds. So I don't know whether I should go through all of that or just leave it for now, and then we can maybe come back to it in more specific ways.
Definitely. So we can always return to, and if you have a list that you use with your patients or people who seek your guidance, I'm sure we can always, if you're available or willing to as well, we can always share it with the crowd too, if any participants are interested.
Absolutely.
Miss Tammy, do you have anything in addition that you'd like to add, or any tricks that you've tried before that have helped?
Yep. Yeah, so one of the things that I recommend highly, it's very, very difficult when you're you're inundated with all these responsibilities and you're taking care of a loved one with dementia, cognitive impairment. So I really encourage all of my clients and my caregivers that I work with to take what I call a daily 10-minute time out. And it is a conscious effort to remind yourself that you're as important as the person you're taking care of. And so you have to make a conscious effort. So we get caught up with, I need to do 30 minutes of this and an hour of this. I'm saying 10 minutes is just enough to take a break from the demands, the responsibilities, and do something nurturing, comforting for yourself. And it makes such a difference, but you have to make a conscious effort to do that. And then I also have when we're feeling stressed out, when we're feeling depressed, isolated, you're at your wit's end, angry, frustrated. These are all emotions that are part of the caregiver journey. So I have 3 questions that I like people to ask themselves, and use your feelings and emotions to empower you. So 3 questions I have caregivers ask themselves. One is, what are your feelings and emotions trying to tell you? What do you need to do differently so that your feelings, to take care of your feelings and emotions, and what is causing you to feel this way? And when you go through those 3 questions, you're now empowering yourself to say, what do I need to do differently to take better care of myself? What do I need to do differently that's going to give me a sense of calm, to reduce the stress, to reduce the anger? So between those 3 questions and taking that 10-minute daily time out is giving back to yourself. It's a way of reminding you, you are as important as the person you're taking care of.
Excellent. Well done. And Dr. Mandati, anything else that you'd like to add in?
That was some great information. What I want to add is that, if you're overwhelmed from caregiving, what are the options? First of all, you have to accept help. I think that's the most important thing. It can help to brainstorm ways that others can help you and actually make a list. It could be a family or it could be a family member or a friend running an errand, taking your loved one for a walk, shopping, cooking. Just find any ways that other people can help you. Second, you should be realistic about what you can provide while you still maintain your own physical and mental health. It's important to take care of yourself, because even though you may be taking care of someone else, who's really taking care of you? And in terms of resources, I think it can help to join support groups. Sometimes if you do need like a break in time, you can get respite care. Respite care is a short-term relief for primary caregivers. It can just be for a day, a week, or a few weeks, but it gives you a break so you can take care of things that you need to do.
I'd like to say one more thing off of what Dr. Mandati mentioned. I think that's one of the most difficult things about caregiving. Is one of the healthiest things we can do is know what our limitations are and know that we cannot do it alone. It is okay to ask for help. know that there are resources out there. You deserve to take a break. But I think in all of my work with my clients over the years, that's a hard concept. We have these expectations that I'm responsible and I should be able to take care of my loved one 24/7. And I would like to give everybody permission to know that you have limitations. It's okay to ask for help. And the more honest you are about what those limitations are, we can now provide you with resources to help fill in the gaps for what you can't do, for what you don't want to do, and for the things you don't like to do. It is okay not to be able to do this 24/7. It's almost nearly impossible to do this alone. So the sooner you can give yourself permission and sooner you know what those limitations are, the sooner then we can plug in the resources to make this journey, to make caregiving easier on you.
I'd like to add something to what Tammy said as well. When someone comes to therapy, what I do, whether they are a caregiver or not, I try to look at the big picture. I try to look at their belief system, try to look at the culture they come from, their perspective on things. And when you look at a caregiver, sometimes they come in with feeling like a victim, like there's nothing else I can do. This is my plight, and I'm gonna have to do this. And so depending on how they present the problem, I deal with it differently. The other thing that happens is that oftentimes, I want to say 99.9% of the times, as people deal with caregiving issues and their frustrations and so forth, a lot of other things come into the picture. A lot of other psychological issues that they may not have had enough time to pay attention to comes into the issues. So it gives us a place to work with holistically on what all is happening to the caregiver, what all is getting stirred up. And it's a world of information and things that we can pay attention to. And the bottom line becomes two things. One is, what's your perspective? Based on that, you either have an easy time with it or you have a hard time with it. It has to do with your perspective. The other thing that is really important, and Dr. Mandati was referring to it, I think if you don't have a balanced life yourself, if you're not taking care of your own self in your own life, you will have a harder time with caregiving for the loved ones. So it is your first obligation is to yourself. And there are many ways to take care of yourself.
That was all very well said. I mean, I will echo those sentiments too. I've definitely seen it where being a caregiver kind of consumes somebody, and you forget about taking care of yourself and whatever else is going on in life. And obviously it's respectable caring for somebody else, especially a loved one. But I agree. I mean, you have to be able to take care of yourself or else you will be essentially an ineffective caregiver. So to piggyback on this past question, everything we've just discussed, I think something important to ask and to be able to share with our viewers is, what are the signs of caregiver stress? And so Dr. Mandati, I'd like to start with you.
Signs of caregiver stress. First of all, I want to define what a caregiver is, because I think oftentimes family members who are actively taking care of an older adult, for example, don't identify as a caregiver and they don't get the help they need. A caregiver is anyone who provides help to another person. It could be a sick spouse, a disabled child, an aging relative. Caregiving can be very rewarding and it serves a very great purpose, but at times it can be stressful. It's natural to feel sadness, exhaustion, anger, frustration. Now, what would you look for in caregiver stress? You might feel overwhelmed, worrying all the time, eating too much, eating too little, sleeping too much, sleeping too little, losing interest in activities, feeling sad, having new pains, coping with alcohol or drugs. Many of these symptoms are what you might find in anxiety and depressive disorders. So if you are having a lot of these symptoms, I would advise seeking professional help.
Miss Tammy, anything you'd like to add in addition?
Yeah, I'm gonna say that in addition to all of those, a frequent thing that I will hear often is, I don't like who I'm become. I don't like who I've become. They may not do, exercise as much, or they don't like that they're losing their temper. They don't like that they're short. That they cry on a dime. And usually when I hear that, I know that that is a huge red flag to say, I don't like who I've become, because the demands, the responsibilities, I am working so hard, I'm overwhelmed, I feel isolated, I feel alone, that those are red flags to say, you know what, I need to figure out what I need to do differently to take better care of myself, which in turn will help me take better care of my loved one. But that's a frequent marker that I listen for, in addition to, people are going to dismiss, I feel overwhelmed, I'm angry, but it's when you reach that, you want to try to catch it before you reach that breaking point, right? That I'm just snapping. And it's very hard to know what that fine line is. But if you just start sensing you're losing yourself a little bit, that just start tuning into, wow, maybe this is a time for me to intercept what I'm doing, so that it doesn't get to that point where now you just don't like who you've become, but just know that that's a natural progression, unfortunately, of the caregiving process, that you are doing the very, very best you can. But keep in mind, again, that we have to check in with you and see how you're doing during and throughout this journey.
Well done. Dr. Mand, anything else?
Some of the things that I've come across is anger and resentment. People feel very angry and very resentful. And then on top of that, if that isn't bad enough or difficult enough, they have guilt feelings that just is killing them from inside. It's just debilitating. Such strong guilt feelings. And so you have to work through those as well. And there are many ways to work through those things and to understand and to live with it, or live by it, or not by it exactly, live with it and understand and get around it. Because all of these feelings, guilt and anger and resentment and overwhelm and all of that, is just part of the job. It is just part of the job, unfortunately. So all of that has to come up to the surface and be expressed and dealt with and move on.
I have to support her 100%. The anger, the resentment, and the caregiver guilt, I have to say, Dr. Mann, those three, they're so big that it really eats at the core of who they are. And I'm just going to speak, what really saddens me the most about that is these caregivers are remarkable people. As a caregiver, you are remarkable people, and you do a fabulous job taking care of the person that you're taking care of. And to feel this guilt and take the anger out on yourself and feel bad because you lose your patients, know that you're going to lose your patients. Because you lose your patients doesn't make you a bad person. But the caregiver guilt is so enormous that I feel you deserve so much more credit than the guilt that you place on yourself. Because I just have to say it again, caregivers are amazing, beautiful people, and you deserve to feel good about yourself rather than having this guilt used against you. But I support that 1000%.
Very well put. I'm sure if every caregiver could hear the words that you just spoke, it would make them all feel a little bit better. So just since I guess we're on the topic now, I'm going to take a question from one of our registrants that I think fits what we discussed very perfectly. So the question is, I feel so guilty when I get angry and I lose patience with my mother. She follows me around the house and she asks me the same question 30 times. Any tips for me? Dr. Mann, we'll start with you.
Sometimes I feel like I start with I'm going to start with the last part of it. They walk around and they ask the same question 30 times. It's really interesting. I think a lot of seniors, they want to talk. They want to talk, and sometimes they don't get enough verbalization. Some of the caregivers tend to not talk as much, or their personality is such. And these people oftentimes, especially if they're women, I know that probably sounds funny or whatever, but if they're women, they like to talk more than men. And then it's like going around asking questions is almost a way of saying, talk to me. So if that is the case, then you have to sort of increase the verbal interactions with them. But of course, there are other categories. They, if there is a memory issue, they don't know that they've asked that question before, and they ask it again. And so there are other situations, that other reasons that come into the picture. But sense of humor goes a long way. You can, if you could just feel light about it and be light about it, and take it in one ear and out the other, it helps. And if you just decide to answer again the same question, just so be it, just answer, and don't let it bother you. What was the first part of the question, Dr. Etesa?
The first part, so it was the scenario where the caregiver feels guilty and they lose their patience with their mother when their mother continues to follow them around and ask them the same question. So they were wondering, are there any tips for them? And I think you got in a couple good ideas there.
Yeah, thank you. I think the guilt is part of the job. I have to tell you, it's just, I've never heard of a caregiver who didn't feel guilty about one thing or another. Yeah, you basically identify it, understand it, and note that that is part of it, and try not to have it eat you up.
Well done. Well said. Dr. Mandati, any tips for this caregiver?
With most dementias, there's a progressive loss of short-term memory. And what that means is that your loved one may not be conscious that they're repeated a question that you just asked them. You kind of have to be understanding to that, just because they are not completely conscious of it. And with Alzheimer's, for example, as the disease progresses, short-term memory keeps getting worse and worse, but they may retain their long-term memories. They might revert back to old behaviors from when they were young. And that is part of the reason why they might be defiant to you helping them as well, because they have this sense of independence and they don't understand that they are dependent on others. I actually have a really good example of this. I'm in the hospital, and there's this very kind lady. She was suffering from moderate to severe Alzheimer's disease, dementia, and she worked as a homemaker most of her life. And on the unit, she would clean and make sure everything was tidy. These behaviors were natural to her because it's what she did day in and day out for years. In her consciousness, she's likely not aware of her disability and the fact that she needs help, and she may refuse help for that reason. So sometimes you kind of have to learn about people's past and accommodate to that.
Very well said. That's a good perspective. Ms. Tammy.
So when someone with cognitive impairment, dementia, is following you around and they're joined at the hip with you, it's actually called shadowing. And it is something that people with cognitive impairment do. And it's often fear related, and you're their security blanket. And a lot of times they need to be engaged and stimulated, but they're following you around because you're their security blanket. You're the familiar. You're the one that's going to make it safe for them, make them feel safe and secure. So this is where the more engaged we can keep their brain, the more engaged we can keep them preoccupied and stimulated, the less need they may have to be joined with you at the hip. So sometimes it's looking at what activities can we engage them in based on whatever level they are at, and engaging that brain so it frees you up a little bit. A lot of times though, if we have somebody who is shadowing you, it's usually based in extreme fear, uncertainty, feeling a sense of insecurity. And then I do want to talk about repetitive questions, because I do feel repetitive questions are an expression of some need. And people with cognitive impairment don't know that they're repeating themselves. So there's often themes to their questions. Are they repeating something they're concerned about? Are they repeating something that's memorable? Are they repeating something that's important to them? Are they repeating something that's frustrating to them? But I look at repetitive questions as a way of communicating a need. And if we can figure out what that need is by listening more to what they're telling us, then we'll be able to find a way of probably meeting that need. But I look at repetitive questions as something they need to do. They're sharing that with us for a reason. If we understand what that reason is, then we'll know how to meet that need. Now, that being said, they may ask it again in 5 minutes. They may ask it again in 3 minutes. So I kind of have a 3-step process for that. We need to validate we hear what they're telling us. The second step is to provide a comforting, reassuring response. And the third step is to distract them and get them engaged. So I actually really want to know, what are the questions they continue to repeat, because they're communicating a need to us. They're trying to communicate something. And I think we need to take more time to listen to what it is so we could figure out what that theme is. What is it that they're trying to communicate, so we'll know how to answer them back. And so they may ask 15, 20 times, but you need to know that's because of dementia, and that dementia is causing them to do this. They're not doing that to get on your nerves. So I think listen, see if you can figure out what the need is, validate, provide an empathetic response, and let's have some distractions so we can engage them, get their mind off of the thing they might be worried about, and then we have them engaged cognitively.
Well said. So I think I totally agree. I mean, I think there's a lot of focus in general medical knowledge. Everyone says you should be active, but there should also be, I think, equal as much emphasis on mental health and mental well-being. I mean, you should try to engage your brain. Everybody's brain, I mean, to some degree, is very powerful. You know, it has a lot of potential and it needs to be used. I mean, it needs to be able to be engaged, you know, whether it's reading, whether it's socializing, whether it's doing puzzles. I mean, all of these things will help and they'll go a long way. And I know more and more they've done studies that have shown that, you know, the part of your brain that controls memory, the hippocampus, you know, if you can build up that volume as you're younger and as you're growing, that will serve you better later on in life as well. As you can think with a muscle, right? If you can build up a muscle, make it stronger and stronger and stronger, once you get to a point where you're having difficulty being able to add to that muscle strength and it atrophies, you're starting with a larger reserve. So I totally agree. I think engaging the mind is very helpful, whether you have cognitive deficits or not. So I think we've done great answering questions about caregivers and how they cope with the patients, good strategies, good techniques. I want to dive into a slightly more difficult scenario and a difficult question. So the question is, how do I know when it's time to place my loved one into memory care? And we can get started with you, Dr. Mandati.
So when is it appropriate to go into memory care? 1 second. So usually it's when your loved one's safety is being compromised. You might start to see signs that they're getting worse. What signs would you look for? You know, you might see behavioral changes. You might start to notice that they're becoming more apathetic. They might be more withdrawn. They're no longer interested in activities that they're doing. They might be more agitated, combative. You know, they might not be taking their medications. They might not be letting you care for them. You might notice that they're not eating as well. They're not taking their medications. They're becoming more frail. That's another thing you can look for. They might be getting lost and they don't know how to get back home. You know, these are all things you want to look for in terms of putting them into memory care.
Well done. Dr. Mand?
Yes, in addition to all of that, I think that we have to look at the cultural and financial situations as well. There are some cultures who don't really believe in taking the elderly out of the house and putting them anyplace else. So they will take care of them at home despite all these difficulties. So we, you know, we have to respect that as well. And then sometimes there are financial consideration that makes it difficult one way or another, and people have to make decisions based on that. It really is, all of what Dr. Mandati said is absolutely correct. But I think in addition, there are some practicalities that have to be looked at. And to the extent that the person who needs it is in a right caring place, to that extent, everyone wins.
Well said. And Dr. Mann, I like that you keep bringing in the point of a holistic view, looking at the entire patient, their background, what they've done throughout their lives and where they are now. So, I mean, I really appreciate your point of view. And Ms. Tammy, anything else that you'd like to donate to?
Yeah, in addition to what Dr. Mandati and Dr. Mann had to say, when the caregiver gets to this point, it's actually an excruciating decision for them. And I would say that, how do you know? There's a couple of factors to keep in mind. One is if your health is starting to decline as the caregiver, that's usually a red flag. As your loved one's health starts to decline, what can you manage? Safety is an issue, not only their safety, but your safety as well. And of course, finances. But I will say this as well. A lot of times caregivers have a difficult time making this decision. And let's go back to the caregiver guilt. There's enormous, enormous, enormous guilt around that decision. So I like to have my clients come up with what I call indicators or markers that takes the focus off of them, but places it more on dementia. So some indicators might be when their loved one becomes incontinent, when they're not eating, when they're not swallowing, they are unbalanced. They have to spend a lot of time cleaning up their, excuse my language, but their poop. And it requires a lot more of care that you can provide. And what I love about these indicators or markers, I call them, it now shifts the focus off of the caregiver feeling bad that they're doing something wrong or that they're doing something bad. And it really becomes about the dementia, that the disease has progressed to the point that I cannot manage it alone anymore. I cannot take care of them anymore. I need more help. Whether we bring in additional care into the home and it's 24-hour care, again, culturally, we got to factor that in. Or if we place them, I want it to become about the disease and not that the caregiver is failing them, because it is an excruciating decision when you get to that point. So I want to try to alleviate the guilt that the caregiver feels and really make it about the disease and how this disease is progressing in a way that you need as the caregiver. You now need more support. And what's lovely about the care communities, in many ways, they become like your extended family. And when you hire in-home caregivers, they become extended family. So I try to have the caregiver look at this as what we're doing is we're adding family to care for your loved one. We're not putting them away. We're not placing them somewhere. But what we're doing is we're extending the care that we're offering your loved one, that it's in addition to what you have provided, rather than feeling like you're doing something horrible, you're abandoning them or you're letting them down, especially when they take spouses. They take these marriage vows and they say, I want to stay at home as long as I want to die at home. Dementia doesn't allow that many times. It requires more care. So I want to try to alleviate the guilt and what the caregiver goes through and be open to the idea you are extending care. You're not doing something terrible.
Well said. I know we're kind of running down on time, but one of our viewers just asked a question that I think fits the last question we just discussed fairly well. So he says, my wife just went into an assisted living facility. I have not visited yet at the facility. I have a tremendous amount of fear. Then when I go visit her, she will ask to go home.
Yeah.
What do I say and what do I do? Do you guys have any suggestions? Dr. Mann, we can start with you.
That's a heartbreak. That is such a depressing situation. But that spouse, the person who is asking the question, they need to talk it through with somebody and get some tools about how to convince his wife that she's in a good place. First of all, you who are asking the question, you need to be convinced that you're doing the right thing and this is the right thing for your wife to do. Once you have that, you've got your arsenal ready to deal with it. Then you point out the good parts, the positives, and you let them know that they're not abandoned. You let them know that you, hopefully, I'm thinking that you are allowed to be there every day. I don't know what's happening with the latest rules and regulations considering COVID, but I would like it that you are there every day for her and just basically provide as much of your love and caring to them as possible, and to let them know that nothing has changed and that you are committed and devoted to them and will be doing your best to be there by their side as much as possible.
Very well said. I agree. I mean, you know, it's a very difficult situation, but being supportive is never the wrong answer. That's for sure. I see Angela is on now. Are we out of time, or can we let the rest of the panelists chime in too?
If anybody else has something to add for this question, that is totally fine. And then we will be out of time right after this question. So
I just wanted to add something, you know, as Alzheimer's gets worse, it's common to have what this would be psychosis, psychotic thoughts. You know, unfortunately, like compared to schizophrenia, our medications don't do a great job. It's more about controlling the behavior. I think the most important thing you can do is make sure that she feels safe, she feels loved, and that you're giving her support. I think that will help out the most.
And I will add to that. I actually have, in my book, I actually have a whole section on that, what to anticipate, how to answer that question. It is very, very, very common. And home is more of a metaphor, again, looking for someplace safe, someplace familiar. So you definitely want to validate that you hear her. Thank you for letting me know you'd like to go home. It's so good to see you. I brought you some of your favorite treats. You know, the other day I was thinking about the time I'm distracting and I'm engaging your loved one. I'm acknowledging you want to go home, but you have to feel really good about being there. They'll pick up on if you have any trepidation, if you're feeling sad. But as Dr. Mann said and Dr. Mandati, you do want to embrace that you hear her, and that she wants to go home. You want to acknowledge she wants to go home, provide a comforting response, and then distract her and get her engaged and make her feel loved, make her feel supported, and do the best that you can to try to redirect her in some way. But know that you've got to be in a good place there too. And I have a ton of suggestions and other responses on how to deal with that in my book.
Excellent. Well said, everybody. I guess the one thing that I would potentially add really briefly before we end is to just do your best to make sure that her new home feels like her old home. You know, family pictures, heirlooms, anything that they may want that makes them feel more comfortable. It'll be a daily reminder, you know, of what they had and, you know, that it's still there with them.
Absolutely.
Angela, I'll hand off to you.
thank you, Dr. Edesam, and a heartfelt thank you to all of you. You have done a wonderful job tonight, and we all really appreciate your time and your energy. It was just such a wonderful discussion. For all of those who have attended, you will receive a copy of the webinar and links to the resources mentioned in the program. You will also have an opportunity to send any questions or comments concerning the webinar. Finally, thank you very much for your time and attention this evening, and we look forward to seeing you for the second part of this series on March 30th. Have a peaceful night and a safe tomorrow. Thank you all, and good night.
Thank you, everybody,
Thank
for
you.
attending.